So I'm a consultant in emergency medicine. I was appointed to that post in 1996, currently based at Sunderland Royal Hospital. Prior to that, I completed training in general surgery, having gained the fellowship of the Royal College of Surgeons of Edinburgh, then went into emergency medicine training and have been there ever since. In the general surgical training, we were posted into various areas, and one of those was accident emergency. And I think probably the most attractive feature I found was at that point was the variety and the rapid results. So patients would come in with at that time a single problem which you could sort out and address, or if you couldn't, you knew a specialist who could, and therefore you got a sort of instant rewards. At a very high pace, so it's constantly changing. And at the time I started emergency medicine training was the same time as the National Advanced Life Support courses started, so the PLS, the Advanced Paediatric Life Support. So it was an exciting time for the development of emergencies in general, and I think it was that and the variety and the rapid feedback that drew me towards emergency medicine. The most important one, I would say, is the ability to communicate. And I mean that in the broadest sense, in that that might be obtaining the appropriate comprehensive history from a patient, but equally it could be in communicating to the patient some bad news. And that's often something we have to do in the emergency department, or indeed in answering a complaint. In emergency medicine, the ability to juggle. Sometimes it feels like we're juggling and spinning plates whilst on a unicycle, and within that, the ability to be able to prioritise, because it is very challenging at times. But being honest and maintaining integrity is really important for the care of the patients and for the staff that you supervise. Oh, it's unrecognisable. I started in the late 80s and early 90s when it was still called accident emergency. Obviously, it's changed its name since then to emergency medicine. But the accident bit has almost completely disappeared. So a lot of what we did in the early days would be minor and major traumas. So an essential skill for an ED doctor at that point was suturing and things related to the minor trauma. That's almost never seen now in emergency departments. That's taken on by usually emergency care practitioners in urgent treatment centre facilities. So what we see now is very much acute problems related to often the elderly, whereas when I started off in emergency medicine, and one of the things that attracted me was someone would come to the emergency department with a single problem which you would sort out. Now elderly patients are coming with multiple problems, very complex pathologies which take much, much longer to sort out. And despite that increasing workload, there's been an increased expectation of patients and their families and the media of the quality that we provide. So whilst you've got that increasing challenge, the expectations of the quality of care is actually increased as well. So it's a sort of a double challenge. Well, for me, that interest in ensuring that the appropriate quality of care is provided. I remember seeing a poster, I think it was in our Director of Nurses office many years ago, and I think it was talking about clinical governance or something like that, and it basically said something along the lines of clinical governance, doing the right thing, doing the thing right. I remember that sort of struck a chord to me. And I think that's the same as my priorities with clinical negligence work. It's looking at claims and looking to see if the right thing was done. And sometimes that will mean providing a report that's supportive of the claimant. And sometimes it'll mean providing a report that's supportive of the defence. You know, for me, it's all about ensuring the right thing is done. And as clinical governance lead in the emergency department, which is a role I had for the last 8 years, it was all about providing that best quality of care that you could, and accepting that when things have gone wrong, you have to do your best to put that right. The main thing is being honest. I think it's absolutely vital not to be swayed by the party that's instructed you. So you've got to have an honest appraisal of the case and a huge eye for detail. I've seen some cases swing on just a couple of words written in a set of notes, which completely change things. And I think having that pedantic trait in your personality is not always attractive. but I think it's very helpful in the clinical negligence field. But at the same time, I think you have to have a very pragmatic attitude and not blindly follow guidance. So for instance, national guidance for the waiting times for certain triage categories are at the moment absolutely impossible to achieve with the overwhelming numbers of patients that are coming to ED. So whilst I maintain an eye for detail, it is important that you, as an expert, maintain that pragmatic reality check, as it were, and not just blindly follow the guideline and come up with an opinion that says, well, you didn't follow this guideline, when in fact no one's following that guideline at the moment. So I think being pragmatic is essential. Some of my junior colleagues have asked me about this, and one thing I've said a few times is that if you've done your job right in a clinical negligence report, the reader of that report shouldn't be able to tell which side instructed you. And I often say to myself, right, if you can't tell after reading the report which side instructed you, then the report is balanced and appropriate. One of the things which I think is important in my own practice, and I've not often seen this elsewhere, is sometimes I'll receive an instruction that's several months down the line, and when it comes to me as a second or third expert, it's very clear that either the case is not defensible or it should involve another specialty. And I offer to all solicitors a pro bono informal opinion at the outset of a case, just to discuss the merits of the clinical aspects of the case, whether it's likely to succeed from a clinical aspect, but also sometimes whether the issue is not related to emergency medicine, but is in fact related to care provided in the emergency department, but perhaps by another specialist. And I think that 10 or 15 minutes at the outset of a case is usually a good investment for the case, and it can sometimes save an awful lot of wasted time and money and effort on the part of all those involved. So that's something which I would like to ensure that's offered to instructing parties at the outset of a case. Right. In life, very easily is my family, my wife and my children. Absolutely adore them. And about a year ago, I was seriously ill in intensive care and very nearly didn't make it. And there's nothing like that sort of experience that brings home to you what's important. And although I was dedicating huge amounts of time to work, which I still do, it reminded me, do not forget the important things. And I know it's a bit of a cliche, but my family is absolutely the most important. At work, I think most people in the NHS work very, very hard. And I guess when you get that recognition of your effort, that feels good. So I remember recently one of the junior trainees came through emergency medicine, and in his application to become a trainee in emergency medicine said that he was inspired by me. And I remember feeling 10 feet tall to think that I'd inspired someone to do that. So that I felt very happy about. But sometimes it's smaller things, such as just getting some good feedback on your teaching and someone saying, I now understand this, I've never understood it before, but now I understand it. And that's quite nice. But I think perhaps the single most rewarding thing that's happened at work is a couple of years ago I was voted Doctor of the Year at my trust, and that was a major pat on the back. It's all about the family again, so spending time with them and making as much time as we can with them. Someone said the best things in life are not things, so ensuring that when we are all off that we spend good time and have good holidays and have good experiences. But one thing that did happen in lockdown was that my wife and I bought some exercise bikes, and I'm very grateful for having bought those, and we've kept that up. So that's where we spend just our time. We sit on the bikes and go for it and put the world to right. And if I do get any time after that, I like to read sort of thrillers, a bit of escapism. Yeah, I think it depends what mood they'd be in, but I would like to think they would say things like dedicated, generous, supportive. Yeah, and I wish someone had told me this 20 years ago. A couple of things. One is to be thorough. We mentioned before, sometimes just a couple of words in the notes can make all the difference. So very, very important to be thorough, or almost pedantic, really. And in that thoroughness, to consider both sides of the argument very, very carefully and provide a balanced opinion. It's all about quality over quantity, and not to be too frightened or put off by the opposing views, because if you've put the work in and you provided a high quality, detailed, balanced report, then any opposing opinions from the other side will stand up to scrutiny by the court.